Hello, my name is Patrick. Today we're talking about something that's quietly becoming one of our most urgent national security and public health challenges: cyber attack on the healthcare system. I call it the silent epidemic because its impact are often unseen, yet they're devastating. These aren't just minor IT glitches or bugs, they're escalating in frequency and sophistication, leading to record-breaking data breaches and service disruption. Think about this. In 2023 alone, over 167 million individuals were affected by significant healthcare breaches. That's a tenfold increase in just 5 years. And the trend continued right into 2024, with a staggering 259 American health records stolen or compromised, including the massive Change Health incident. This goes beyond economic crimes. Federal officials and industry leaders are warning us that these attacks directly threaten patient safety. When systems are down, doctors can't access records, surgeries are delayed, and lives are put at risk. This has plainly crossed the line into being a threat to life crime. Now, the current policy landscape, which relies heavily on things like HIPAA fines, simply isn't cutting it. In fact, it can be counterproductive. While accountability is crucial, hitting ready resource-strapped healthcare entities, especially our smaller and rural hospitals with hefty fines, often deplete the very resources they need to build a strong cyber defense. So what's the solution? We need a fundamental shift. A national strategy must move towards a compassionate, proactive, and supportive approach. This means policy that incentivizes investment, foster collaboration, build elasticity, and integrate security right into the design of our system. Take a moment to consider how vital healthcare is to each of us. It's the foundation of our well-being, a cornerstone of our community, the very lifeline of our nation. But this critical infrastructure faces an ever-present evolving threat: cyber attack. So the core question my project aims to answer is this: how can we transition from a reactive fear-based response to cyber attack to a proactive health-inspired model? I envision a system that treats these events as a persistent disease state, enabling us to strengthen the entire healthcare ecosystem, immunity, and resilient, much like our immune system protecting our body. In an age where our lives are increasingly digital, the security of our healthcare system isn't just about data privacy. It's about patient safety, the continuity of care, the national security. Today, we're here to talk about how can we proactively strengthen this essential pillar of our society. Despite rising investment, with over half of our healthcare organization planning increased cybersecurity budget, a total spending project to exceed $125 billion by the next year, we face a stark reality. The average healthcare data breach costs a staggering $10.93 million in 2024, making it the most expensive industry for cyber attack. Just look at the Change Health breach, which alone cost United Health Group an estimated $3.1 billion. But the impact goes far beyond financial losses. These breaches disrupt patient care in up to 75% of cases, leading to delay in service, medical errors, and tragically increased mortality. This isn't just about money, it's about lives. Let's dive into the specific example of what the cyber attack truly means. The Change Healthcare data breach. This incident, which unfolded in February 2024, is now recognized as the most significant and disruptive cyber attack ever to hit the U.S. healthcare system. Change Healthcare is a subsidiary of United Health Group, a critical pipeline in our healthcare infrastructure. They process about half of all medical claims in the United States, connecting to tens of thousands of providers, pharmacies, and insurers. When they were hit, it sent shockwaves across the entire nation. The threat actor behind this devastating attack was Alpha V, also known as Black Cat, a notorious ransomware as a service group. Their initial access was gained through a compromised credential on a remote access portal that lacked multi-factor authentication. This basic security lapse allowed them to linger in Change Health system for 9 days moving laterally and exfiltrating massive amount of data before deploying a ransomware. The scale of impact was immense. At its peak, the breach affected an astonishing 190 million individuals, nearly 1 in every 2 Americans. This wasn't just data theft, it led to immediate and widespread operational shutdown. For patients, it meant delays in getting critical prescription filled, inability to access care, widespread confusion about insurance coverages. For healthcare providers, hospital, clinics, and pharmacies faced severe cash flows crisis, with many unable to submit claims or receive payments for weeks. Some larger healthcare systems report losing over 100 million per day. Smaller rural practices were pushed to the brink of insolvency. United Healthcare Group ultimately paid $22 million in ransom in the form of Bitcoin to Black Hat. This is their attempt to protect patient data from further disclosure. The old adage of "we do not negotiate with terrorists" does not apply in this breach. Due to the infighting among the cyber criminal, the data was still leaked. A secondary group, Ransom Hub, attempted further extortion. The ripple effect of this incident are still being felt today, highlighting the fragility of our interconnected health ecosystem and the urgent need for more robust defense strategy. Let's analyze why HIPAA, despite being our foundational privacy and security law, fell in the face of Change Healthcare breach, and what that means for every other healthcare entity, particularly our smaller and rural facility. Change Healthcare is a massive, well-resourced corporation, a subsidiary of United Health Group, yet it was crippled. This highlights a critical systematic gap. The primary failure point in Change Health breach, which Black Hat exploited, was inadequate remote access authentication. The lack of multi-factor authentication on a critical Citrix server. HIPAA security rule broadly mandates technical safeguard for access control and authentication, but it doesn't specify modern, robust requirement like mandatory MFA. This flexibility often translates to organization implementing the bare minimum, or even worse, overlooking critical controls. Black Hat leveraged this simple vulnerability to gain initial access, then move laterally for 9 days undetected, exfiltrating vast amount of data before deploying ransomware. This wasn't a sophisticated zero-day attack, it was a failure of foundational cyber best practice. So why did it fail? HIPAA was last updated in 2013. Simply hasn't kept pace with the rapid evolution of cyber threat. It doesn't explicitly mandate modern safeguard like MFA or robust network segmentation. While the proposed 2025 update aimed to strengthen the security rules, the pace of regulatory adaptation consistently lagged far behind cybersecurity innovation. Black Hat attack was a clear demonstration of this regulatory lag. HIPAA required a reasonable and appropriate safeguard. For a multi-billion-dollar entity like Change Health, what's reasonable? Should be industry changing? But clearly, it wasn't sufficient to prevent this breach. The vague language allowed for interpretation that may not align with the actual threat landscape. Change Healthcare is a business associate to thousands of covered entities. While HIPAA mandate business associate agreement, the Change Healthcare breach showed that simply having that contract doesn't guarantee security. Many smaller providers rely on Change Healthcare to be secured, and that trust was broken. If a giant like Change Healthcare can be brought down by a basic security lapse, what hope do smaller, rural, and under-resourced healthcare providers have? These organizations already struggle with limited budget, outdated system, and severe lack of skilled cybersecurity staff to meet even current HIPAA compliance requirements, let alone defend against sophisticated groups like Black Hat. They're operating without the tools or support to modernize, leaving them open to an attack. The Change Healthcare breach painfully exposed the limitation of individual reactive defense. It made it clear that we cannot simply expect every single entity from the largest healthcare system to the smallest rural clinic to independently withstand the onslaught of a nation-state actor and sophisticated cyber criminal gangs. We need fundamental shift mindset, a new paradigm centered on shared resilience. This concept is about not placing blame, it's about reorganizing that in an interconnected ecosystem like healthcare, the security of one is dependent on the security of all. Our goal must be collaborative defense, bringing stakeholders across the entire healthcare ecosystem together to enhance security, focusing on system-wide immunity rather than individual fault. This leads to the idea of system-wide immunity. The focus must shift from merely protecting individual organizations to fortifying the entire healthcare ecosystem. Imagine a network shield where every organization contributes to the benefit from a collective defense. This means shared resources, expertise, and common understanding of threats, create a more robust, adaptable posture across the board. A critical component of this is the near-miss data sharing. Currently, there is often a stigma around cybersecurity incidents leading to underreporting. But what if organizations could pool information about near misses, those incidents that are almost result in a breach but were successfully contained? This allowed others to learn from a close call without the stigma of public failure. It's about proactive intelligence, not punitive measures. Imagine the lesson we could glean from the early warning sign that Change Healthcare might have seen if such a mechanism were robustly in place. This collective intelligence fuels collective learning. By sharing experiences, both successful defense and close calls, we can rapidly identify common vulnerability, emerging attack patterns, effective mitigation strategies before they escalate to full-blown breaches. This is especially vital for our smaller and rural providers. They often lack the dedicated cybersecurity team and resources of larger institutions. Through collective learning and shared playbooks, they can dramatically enhance their defensive capability, effectively leveraging the knowledge and insight of their entire sector. Shared resilience is about building a proactive, collaborative, intelligent defense. It's about moving from isolated fortress to an interconnected, self-healing network, ensuring that the critical service of healthcare remains available and secure for all Americans. Building on the concept of shared resilience, a critical enabler is a new approach to breach reporting. Imagine a system where the primary goal isn't compliance or punishment, but a unified data collection, analysis, and collaborative response. This moves us away from the current, often fragmented and fear-driven report landscape. The current environment heavily relies on punitive measures like HIPAA fines, often discourage transparency. Organizations are reluctant to report incidents, especially near misses, if they fear immediate public backlash, reputational damage, or even severe financial penalty. This creates a dangerous silent epidemic of underreporting incidents where valuable lessons are locked away, preventing the wider industry from learning and adapting. By truly embracing shared resilience, we foster a culture where providers are more likely to report incidents. If they know the focus is squarely on learning and collective improvement rather than immediate finger pointing and punishment, this shift in perspective is paramount for achieving genuine system-wide immunity. What does it look like in practice? First, unified data collection. Instead of multiple different reporting requirements in various agencies like HHS, CISA, FBI, even the FTC, we need a streamlined, centralized mechanism. This would gather comprehensive, standardized data on breach vectors, exploit vulnerabilities, threat actors, tactics, and response strategy. This isn't just about the number of affected individuals. It's about the technical details that inform defense. Think of it as the central nervous system for cybersecurity intelligence in healthcare. Second, this unified data enables robust analysis and response with richer and more granular data. We can move beyond simply reacting to individual breaches. Experts can identify pervasive vulnerability, track emerging threat patterns across the entire sector, and develop proactive, industry-wide mitigation strategy. This collective intelligence will allow us to pinpoint weakness before they exploit on a large scale, similar to how public health collect data to track combated disease outbreak. The Change Health incident highlight that we need this profoundly. Imagine if a near miss involving a similar remote access vulnerability at a large healthcare entity has been transparently reportedly analyzed, leading to a sector-wide advisory on urgent MFA implementation. before Black Hat can strike change healthcare. This kind of proactive collective learning, fueled by transparent reporting, is the ultimate goal of shared resilience and our path to a truly hardened healthcare infrastructure. The challenges facing our healthcare providers, severe budget limits, outdated technology, and dire shortage of cybersecurity staff, make them incredibly vulnerable. This is why a government-backed framework isn't just a good idea, it's absolutely critical for delivering robust, affordable, and easily implementable protection. The framework is centered on three core components. A SOC center to serve all rural facilities in the state or region. This centralized threat monitoring, incident response, and vulnerability assessment creates powerful economy of scale. Eligible rural hospital in initiative with major tech companies like Microsoft and Google, securing free or deep discounted security product, expert consulting and training. The government will facilitate these long-term deals. Pooling IT and cybersecurity talent regionally, allowing expert teams to serve multiple facilities. They will also provide free target training on essential cybersecurity hygiene, including incident reporting. To support this, I propose 3 essential federal support technology grants, spanning these programs to fund crucial hardware, software upgrades, and implementing security best practice. Creating a manageable marketplace with pre-vetted securities vendors, streamlining procurement, ensuring quality for rural providers. Phase implementation. Start with the high-impact, low-cost measures like multi-factor authentication, then gradually tackling more complex issues. This entire framework was designed for maximum cost effectiveness. Rural hospitals share the burden of hiring and monitoring. They leverage free or subsidized resources and share SOC and training improve responses without duplicating efforts, ensuring even the smallest facility can achieve essential security. We don't need to reinvent the wheel for better security. Microsoft Defender offers a powerful integrated ecosystem designed to boost your organization's overall security posture. Let's explore how the key feature works together. First, exposure management helps you understand your attack surface. It clearly lists areas needing attention and provide progress so security engineers can quickly grasp vulnerability and prioritize effort. Next, Microsoft recommendations are straightforward, empowering engineers to easily identify issues, assess compliance. The impact rating helps prioritize the most critical risks, ensuring efficient problem solving. Finally, the security score. This section gamifies your security journey. It tracks metrics and motivates continuous improvement. Achieving a higher score encourages engineers to push for better security and foster a proactive culture. By leveraging exposure management, recommendation, and secure scores in Microsoft Defender, you're not just reacting to threats, you're proactively building more secure and resilient environment. This brings us to a crucial and often uncomfortable question. When a company like United Healthcare incurs billions in breach costs, do these expenses ultimately get passed down to patients? This is a critical concern, especially given in the unprecedented scale of Change Healthcare breach and its ripple effect across the entire healthcare industry. Let's look at the broader industry trend first. According to 2024, reported by IBM, the PNOM institutes a striking 63% of organizations across all industry report passing the data breach costs onto consumers, up from 57% just the previous year. In healthcare, these breaches are almost more expensive, averaging nearly $10 million per incident in 2024. This trend makes it a question of cost pass-through relevant for our sector. While United Health Group has not issued a direct statement confirming that the estimated $2.45 billion in Change Healthcare breach costs will be passed down to patients, the mechanism for cost transfer in our complex health system are very real and concerning. So where would it impact? Higher insurance premium. United Healthcare Group and countless affected providers seek to recoup their substantial loss. You can see this indirect effect through increased insurance premium and deductibles or higher fees for various services. Reduced service and availabilities or quality. If providers, especially the smaller and rural ones, already struggling financially from the disruption, are forced to cut back on resources due to unrecovered losses, could lead to reduced service availability and longer wait times and even impact on quality of care. And moving forward, the industry will undoubtedly invest more in robust security measures, as they should. However, these increased operation expenses could ultimately be factored into patient billing, further contributing to the rising cost of healthcare. Given United Healthcare Group's colossal role in healthcare payment processing and insurance, any significant cost recovery effort could possibly affect patient due to these indirect systematic changes. While we don't have explicit evidence of direct breach surcharge on patient bills as of today, the interconnected nature of healthcare finance making it highly likely that the financial burden will be trickled down to the patient. The federal government has recognized the critical need to bolster cybersecurity in the state and local level through programs jointly managed by FEMA and CISA. Over $1 billion in grants are being made available over 4 years, specifically to enhance cybersecurity for state, local, territorial, and tribal government. The primary aim is to address cybersecurity risks to critical public information systems, which absolutely includes the healthcare system managed by or on behalf of these government entities. In conclusion, escalating cyber threat against healthcare represents a reflective national crisis, directly impacting patient lives, eroding public trust, and undermining national security. Our current reliance on punitive policy has proven insufficient and honestly often counterproductive. To combat this silent epidemic, we must fundamentally shift to a compassionate, strengthened, and forward-looking policy framework. Healthcare cybersecurity is a shared national imperative, demanding collective action and strategic federal investment. This means incentivizing proactive defenses, fostering collaboration, build a robust workforce, and mandating secure by design principles in medical technology. Reaffirming cyber safety is patient safety, meaning moving beyond reactive stance to a proactive, supported approach. This unified national commitment will enhance patient safety, strengthen national security, and ensure uninterrupted, life-saving care across the nation. This is our call to action for a truly resilient healthcare future. Thank you. And here's are my references.